everyone. My name is Misty Servia. I am the president of Manatee Tiger Bay. I'm so happy to be here with you all today. We are going to begin with just a few announcements before we do the Pledge of Allegiance. If everyone could please turn their cell phones off. Let's go ahead and do the Pledge of Allegiance first. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Please be seated. And again, thank you all very much for being here today. This is our last meeting of 2015, and it is going to be a great one. So as we end the year, I would like to ask all of the Board of Directors members to please stand for just a moment so they can be recognized for all the hard work they've done this year. Thank you very much to all of you. Also, I would like to give great thanks to METV. You know, they are here for every single luncheon that we have. They put all of our recordings on metv.com on the YouTube channel. So please don't forget that you can always go there and access any programs that you have missed. Also, as you know, this year, one of the things that we did was we started the Tiger by the Tail Award, and it has been a really fun program. So I want to say thank you very much to Cindy Unzicker and her business, which is Bite Me Cookies by Cindy. She has done a great job supporting Tiger Bay. She always gives us this wonderful package of cookies, which today, if you're the winner, you can see it's a holiday cookie jar. So it's extra special. So get your questions ready. And then finally, just on behalf of the entire Tiger Bay Board of Directors, I want to wish you all a Merry Christmas, a Happy Hanukkah, a great season, because our year is coming to a close. And this will be my last Tiger Bay meeting that I preside over as president. I am leaving as president to run for the Manatee County School Board. But you will be in great hands with Mr. Ben Bacher, who has been our program committee chair. He is the one that's organized all these great programs, and he will be our 2016 president. So thank you for helping Ben with anything that he may need as he carries this club forward. And please continue to support Tiger Bay. Please renew your memberships. We are taking renewals now with Elaine, or in January, you'll be receiving something over the email. So thank you again very much. All right, so Tiger by the Tail. Let's talk about that so everyone understands the rules. So we are going to hear from our panel members. And after we are done with that, we will have questions and answers. And during that period, whoever can ask the most thoughtful and engaging question is going to win our Tiger by the Tail. And with that, you will get a very special Tiger pin and the holiday cookies. So only members can ask questions. If you are not a member, we will sign you up. Just go to the back table, no problem. So everyone get your questions ready. And now on to the program. So what we are going to do is just begin with the rules. Everyone at the panel, we have 3 panel members speaking, will have about 8.5 minutes to do their comments. I've told each of them that when they have 60 seconds left, I'm going to stand from my chair as kind of their signal to please wrap it up so that we can stay on track. And after they are done with their comments, we will have the question and answer period begin. So when that happens, please go to the microphone right over here. Ask your question, let us know your name and that you are a member of Tiger Bay, and please tell us who the question is directed to. If the question is directed to all panel members, state that, or one person in particular, that is fine also. But please, no comments or no editorials. Let's keep our comments to questions. Let's keep that to questions. So I'm going to begin with an introduction of our speakers. Our first speaker will be Avery Burke. Our first speaker will be Adele Arosier, Executive Director of Turning Points Manatee, followed by Captain William Fowler, Patrol Division of the Bradenton Police Department, and finally Avery Burke, Homeless Outreach, Centerstone, Florida Hospital and Addiction Center. So with that, Adele, if you will come up and start our program. Thank you.
Well, I'd like to thank everybody for having us here again. It seems like, I hope this isn't a routine, every 2 or 3 months I'm coming back. Although I do like the idea of having homelessness raised as an issue in our community because I think it's very relevant and it's getting a lot of attention, and I hope that we can use that attention to generate some incentives and motivation for going for solutions. So today I wanted to start with the information that came out to you, the facts, the figures, the future for homelessness was the headline for this session. So I just wanted to say a little bit to start with about who are the homeless, because we label people as homeless, but there are lots of different populations that make up what we call the homeless population, or if you're going to be politically correct, the new thing is to call them roofless residents. So I'm going to use both those terms, roofless residents. So the homeless people in Manatee County and throughout this nation and throughout the world, labels can be put on them, but basically they're you and me. In our situation at Turning Points, what we see is that there isn't any difference in the population that we have in our center than what we see in any event that we go to or that you may attend. And in fact, many times I've seen people that come up to me at events and said, I got help from you and I really appreciate it. So it's you and me, and also there's these niche populations that we do label because they tend to have organizations attached to them that want to help just that certain kind of population. So for example, in Manatee County, we have Hope Family Services. Their niche population is domestic violence, either women or men, and children. We also have people like Selah Freedom. They're working with the human trafficking people, which are also many times homeless and on the street. And Manatee Glens, or now Centerstone, working with those who are mentally ill and addicted. So there's different subpopulations that we call of this major homeless population. And to top that off, the federal government has been working on this problem for years. As I said, this is a problem not just in Manatee County or in Florida, but throughout the United States and actually the world. And what they've come up with at Washington is different definitions of homelessness based on what's going on in the country at the time. So for 10 years ago, or 11 years ago when I started, I think I've told you the major population that was homeless was men. Probably 95% of the people you saw on the street or that were here were men that were homeless, whereas now we're seeing half and half women, half men that come in for services to the one-stop center that are homeless. So the face of homelessness has really changed. And also HUD has decided, HUD, Housing and Urban Development, which is providing the federal dollars for many of the programs that have to do with homelessness, they've decided that they're going to change their definition of homelessness and who gets money. So through the years, this definition has changed, and this is the current definition of who the homeless are, the chronic homeless. An individual or a family with a disabling condition who has been continuously homeless for a year or more, or has at least 4 episodes of homelessness in the past 3 years. So there's a lot of stuff in there. A disabling condition. What's a disabling condition? So then you have to run through, do they meet that criteria to get funding for certain programs? Like we have an ESG program, an emergency solutions program that helps people with money to get into housing. Or we had a Shelter Plus Care program that was aimed at those people who were chronically homeless on the streets with 2 co-occurring conditions. So there's lots of rules and regulations about if you meet those homeless definitions. But when you actually go out in the street, and what we see actually coming into our center are another group that don't fit that definition. And what they do fit is the definition that comes from the Department of Education, and that's through the Mckinney-Vento Definition. And that one is basically individuals who lack a fixed, regular, and adequate nighttime residence. And then they have 4 different criteria that include what the children have to do. So this is more aimed at families. And when we do now what's called the point-in-time counts, which we do annually, usually January of every year, we're looking at only chronic homeless people. But actually, the whole gamut of people who are homeless, if you counted them, it would increase the number of homeless people by quite a bit. So there's 2 definitions because there's 2 populations, but when you start looking at that question that I get all the time, how many people are homeless in Manatee County? It's very hard to answer because today there might be this number, tomorrow there's this number, and there's no way to track that. And we're talking about different populations in there. So it's very nebulous, gray area, but we always do know that there's quite a few children that are homeless. We're able to track that through the Manatee School Board, which has the Project Heart, and they look at how many kids they can identify throughout the school year as being homeless, and they count the children that are actually enrolled in school as well as their siblings. And so we know that in the last 3 years at least, there's more than 2,000 kids every year that have been homeless that they've been able to identify. But again, if you look at this and you dig deeper, you find that there's a lot of women who come into our center who only have children that are under school age. So they are not going to be counted in that. So you can increase that 2,000 probably by another 1,000 if you include all of those, because most of those are women that are having trouble because they're young and have multiple children. So there's a lot that has to go in what the definition of homelessness is. And then I think what we're talking about today are some of the things when we saw the question saying there's a large influx of homeless to Manatee County. I think what we're looking at is the chronic homelessness. So I thought, well, I've never looked at this. We do have a question what we ask people when they come into the One Stop Center on our intake. So I was able to use our homeless management information system and get statistics on how many of these people actually that we see are from Manatee County. So what I came up with is the question that we ask is, what is the zip code of your last permanent residency for 90 days or more? So when they're coming into us for the first time, we ask, where are you coming from? Where were you most recently permanently housed? And from July 1st through November 20th this year, we had 3,102 clients that were unduplicated. And of that, 854 were new, or 27%. And of those new clients, 78% were housed most recently in Manatee County. So 78%, more than 3 out of every 4 are coming from Manatee County. The ones that are coming from somewhere in Florida was 85%, and then another 15% are coming from states outside of Florida, and there was only 2 states that had more than 1 person. So they're coming from everywhere. There's this big perception that everybody does a big influx into Florida for the wonderful sunshine and the great services we have down here in December. But I looked at the statistics for that also and found that in the last 3 years, the highest months that we have start in July and August. We have the highest numbers of new intakes for new clients. So that kind of is counterintuitive to that feeling that they're coming down here for a vacation during the wintertime and going back. We don't have so many snowbird homeless people because they mostly are coming here when they're coming for work. What we find is that a lot of them come down here because they have families that they have been told, come on down, I'll help you get a job and you can stay with me. And then what happens is they have a family fight, believe it or not. And pretty soon they're out on the street or they're trying to find somebody else to live with, and we have a large percentage of them also living in cars. So these are some of the statistics. I have more, but I'll wait till you ask me questions. And I just hope that if you have questions also about why do people become homeless, there's so many different reasons. They all have a different story. And I think it's really important to understand that everybody's story is unique. Having a job is not the answer. 30% of our people in Manatee County have a job, and they're still at risk of homelessness. So there's it's a very complicated issue. If it was easy, we'd already have the solution. So thank you.
Good afternoon, everybody. My name is Brian Fowler. I'm with the Braden Police Department. And Adele gave out some really good information. Just on the homeless, we deal as police officers, we deal with generally with a specific cross-section. And that being the homeless that have addiction issues and mental health issues. We see it every day, and we have to deal with it by taking them someplace that can provide them with the help that they need, whether it's mental health or medical, and sometimes we have a hard time dealing with that. And that's when the people at Cornerstone come in. We refer people to the one-stop center, and that's a big help. And we deal with a lot of people, and what we see are a lot of women that were pointed out. And for us, when we're doing our job, the women are the ones that are the most vulnerable, because they have a lot of men around, and it brings up instances of sexual abuse, which we have to investigate. Sometimes that is very violent. And then we also have to deal with the children that are homeless. And sometimes they're very susceptible to the same sexual abuse and violence, and also domestic violence. We refer a lot of homeless to Hope Family Services. We do deal with a lot of married couples. And we also we deal with, and especially the patrolmen, with some of the homeless that, for a lack of better words, choose to be that way. You know, we try to help them. We try to point them in the right direction. When I was a patrolman, I can remember dealing a lot with a gentleman that was a retired colonel from the United States Army. He had spent a lot of time in Korea and a lot of time in Vietnam. And when he retired, he decided that he just couldn't handle the being around a lot of people, and it was better for him to be by himself and be outside. And I always found him over at the old library, sleeping on the steps. I would try to get him to help. Back then, we didn't have a lot. We had Manatee Glens back then, but they really couldn't help him, so we would have to refer him to the VA and help him that way. But we see a lot of homeless veterans that need help. Again, they have some mental issues, and some of the homeless that we, as law enforcement officers that we deal with, they do commit crimes of opportunity. Sometimes they'll walk by a vehicle that might be unlocked, that has property in it, and they'll take it, and they'll go pawn it, and they'll use it for narcotics or even alcohol. And we see that constantly. But we also have to deal with those that are homeless, that just do their own thing, that they stay to themselves, and they go out and they'll be in places where you might be or your family might be, but we also have to afford them the rights that we afford everybody else. You know, we have to treat them the same way that we treat everybody else, and sometimes that becomes an issue. As everybody knows, we're blessed with this beautiful weather. Everybody wants to come to Florida, all cross sections of life, especially this area. I mean, look at the services that we have. We have all the shopping. We have great shopping. We have beaches and just the beautiful weather, and it draws people here. And sometimes, you know, the two come together, the homeless and the people that aren't homeless, and the issues come up, you know, the theft issues. You know, homeless people are invading our space. What do? You know, let's call the police. Well, sometimes there's not a lot that we can do as police officers. Like I said, you know, we have to protect their rights as much as we have to protect your rights. And we do have ordinances that when we find that the ordinances are violated, we take action, such as our camping ordinance. But sometimes it's hard. We, as police officers, we like to have compliance, but when we have to and we have to make an arrest, we do make the arrest. But again, we try to get compliance, and when we come across somebody that does need the help, we look to agencies like Centerstone and Turning Points and Salvation Army. Salvation Army helps us out quite a bit in the past. You know, I've come across some families that have needed help. They haven't had a place to stay, and they've taken them to the hotels down on 14th Street when we had a number of them down there, to get them rooms and get them shelter that they need, especially the ones with children. And we all know that when you're dealing with children, that's kind of a heartbreaker right there, especially when you see a child and their family homeless and living out of their car. We do the best that we can with that. And I wish there was a lot that we could do more. And as we start working on this, we try to communicate amongst each other to help each other out. And I think that's where our solution is, to be able to have a good line of communication between all of these organizations to help the homeless. So that's all I have.
Thank you very much.
Thank you.
Good afternoon. My name is Avery Burke, and I'm a homeless outreach specialist for Centerstone. Probably about 12 years ago, we started going out looking for people that had mental illness or substance abuse to try to get them back in services, and quickly found that just wasn't going to do it. The homeless picture was much bigger than what we had envisioned. So we had to come out and we had to get in touch with Turning Points and different agencies to try to see what the homeless picture was about. Quickly we found that homelessness wasn't just a street thing. The people we saw walking the streets and the ones we see that may be talking to themselves. The one that's had a little bit too much to drink and maybe sleeping on the streets. That's the picture that everybody saw, but we quickly found that it was more to it. When we started dealing with issues of substance abuse or mental illness, we found that it was doctors and lawyers and business people that went through some things that caused them to kind of turn away from society. We found that it was a camp out near the beach where it was a group of veterans that lived. And the camp was actually pretty nice. I mean, when you go to say, we living out in the woods, but their military skills came in handy, and they made that their home. But when we look at it, they were homeless. So we had to find what we can do to help and how we can help. We can take people to Centerstone and we can give them 3 or 4 days, or we can give them 2 weeks. But what happens when they're released? We had to figure something to say, how do we help that situation from being homeless, and then 4 days later you're in a facility, but then you go back to homelessness. It's bigger than a lot of when we look at it. So homelessness, she gave you the definitions, Adele gave us all the definitions of that homeless picture. And every day when we go out and we see the different people in those different arenas, and we have funding, federal funding, that can help a portion of that. We have state funding that can help another area of that. And we need to be able to fill in the gaps. My job as an outreach person, I walk the streets. We go on the streets and we try to address the people that are on the streets that are homeless. We try to figure out what their needs are, and we try to direct them to those needs. So when that picture looked 12 years ago, when we looked at that picture, like Adele said, it was we looked at a great deal of men, and there wasn't a lot of women. As the years went by, that changed. So that started going down to more women being homeless. And the funding was geared toward people with substance abuse and mental illness. So we had a big group of people that wasn't getting help with the funding. As we go back a little bit and we look, that picture has changed again. to where now we have a lot of people living in cars that's considered the working poor that can't afford rent, but they're working every day. We have families, which in the schools we have a tabulation of how many people are in the schools, how many kids. Some of those kids don't get counted, like she said, but they're living in their cars. We have families that are living in hotels. I get calls daily from people living in hotels that's been in hotels for 3 and 4 months. They can't afford to get out the hotel because they have to pay for the hotel, and they can't afford to get into an apartment because they don't have the $2,500 that it takes to get into an apartment. 1-bedroom apartments in Manatee County now average $800, anywhere from $750 to $850. 2-bedroom apartments are $1,100. $8.50 an hour. $7 an hour don't handle that. So the picture of homelessness is much greater. We do have services. Centerstone offer an array of services to the mentally ill and the substance abuse user, but we don't have all of it because we still need help with after they get the assistance. After they get straight, we can give them medication. We can give them programs. We can case manage. But we still need help as a community. We have to look at how we can best serve our homeless community. Not just the street homeless, not just the mothers, but the whole picture of homelessness. We have a bunch of gaps, and I hope we get some questions about some of those gaps. Because when we look at it and we print things in the paper and you get quotes from people, you get quotes that are not complete. So we get a picture that is not complete. So homelessness in Manatee County is here. We have services that can help, but as a community, we have to come and help as well. So I'm going to sit, and I hope we get some good questions so we can continue this conversation. Thank you very much.
Thank you very much to all of our panelists. And now is the time for questions and answers. This is such an important topic. Who is going to ask our first question? And you can line up behind one another. You do have to be a member to ask a question. Just a reminder, please tell us who you are. Chris, you can start.
I'm Chris Willie, and I'm a member of Tiger Bay, and my question is to Adele. Is there a council of stakeholders in Manatee County working on this issue, providing a broad-based solutions that include mental health and addiction services, law enforcement, and all those many angles and many pieces of the puzzle? If there isn't a council, why not?
I'm not sure I can answer why not, but I can tell you there isn't. There is no one group, and that's exactly what we're calling for. That most communities, like I had told you when I was in the round table, I attended a state meeting a couple months ago, and at that meeting, what I found was that the organizations in the communities throughout the world, or throughout the state, were making headway because they had something like that. People had decided this is enough, we need to do something as a community. They get together, and it's not the government, it's not the police force, it's not the social services, it's not the businesses, it's all of them. And if you're missing one player at the table, things don't get done. And that's what we need to do, is convene this kind of stakeholder committee, group, whatever, to come together to look at these kinds of things. And I've actually had a lot of hope that the Faith-Based Alliance was going to be that kind of group, where out of that group we could grow that, because we do have representatives from all of those stakeholder groups there. So I'm hoping that we will be able to grow that, but we don't have something like that at the moment.
Thank you.
My name is Becky Kness. I'm on the board of the Tiger Bay Club, and I'm also the CEO of Just for Girls. And I wanted to ask you a little bit about the proactive things that are being done to prevent homelessness after we've heard a little bit about the reactive things like shelter, treatment, medical, and even law enforcement. I'm very interested too in recalling a very costly study that the Manatee County Commission did. And since we paid handsomely for it, we need to recall that and use the information that was recommended by that consultant who, after several months and much cost, concluded that homelessness is the result of poverty, and issues to solve that is the result of education and jobs. And so I was happy to see Avery mention the gaps, because I really think you can't change what you don't acknowledge. And I'd like us to all take a look at what we're doing proactively to prevent homelessness and what we're doing in the area of job skills training, education, and prevention.
And is your question directed to each of the panelists?
Any of the three?
Okay.
Yes.
Or any of the three who would like
Yes.
to tackle it?
Thank you.
Avery?
Okay. On that, and it goes back to what we said about community. We have a plan that we did 10 years ago that maps out all of those areas that we still have not yet got into enough to do. It goes back to, like I said, about rent. If you can't afford to get into a place and you're working, then we have to look at how can we adjust the wage, adjust the rent as a community so the landlord can make money, but also that person who's renting can afford to get in and stay. So that's not a state or federal thing. That's a community thing. And in this community also, we have a problem that we have a lot of people on fixed income. 733, 750 don't get you a one-bedroom apartment. It don't get you a studio apartment. So as a community and as landlords and people that, we have to come together, and if we can get that committee that Adele's talking about together, where everybody's sitting at the table, those issues can be addressed, and we can get those issues on the table, and we can get people in housing.
Thank you. Okay.
Definitely education is important, and I think one of the things that the early learning, the program, the United Way, to help me with that. Campaign for grade level reading is one of your long-term solutions to that. So that is one of the proactive things that they've come up with. But I think there's a lot more that we need to do. Again, if we're looking at, just as Avery said, what are the root causes of homelessness? Obviously, it's not having a house. So what can we do to look at those different groups, those niche populations that need housing at every level of income, not just the over 200,000 and above or the 150,000 and above, but those that we see if you're starting to plan for the future in Manatee County and you know that you're going to have a large baby boomer population that's probably used most of their income just being able to keep up now. What are you going to do when they don't have anything anymore? You got to think outside the box, as Davis had said to me the other night, different solutions for kinds of housing that maybe isn't traditional. Modular homes, small homes, living in houses that are 400, 500, 600 square feet. These are all solutions that other communities have come up with that we need to start thinking about now. It might require zoning changes. It might require some changes by the county in their rules, or the comprehensive plan, or the city in their plan. But these are things that we need to bring to the table with this group. And again, I think that once you start looking at those root causes, we're doing what we can, but we need to be doing so much more as far as coordinating our efforts. So, thanks.
Valerie?
I'm Valerie Vale with Manatee County Medical Society. I am a Tiger Bay member. I realize that not all homeless people have substance abuse issues, but does substance abuse lead to homelessness, or does homelessness lead to substance abuse?
Avery?
To anyone who can answer.
I think that can be done both ways. In working with one of the camps we worked with a few years, it took about 5 years to get just about everybody out of that camp. But what we first saw was substance abuse. But then after, when I said earlier about we saw lawyers and different people in segment of society in that, we saw that in that camp. I mean, we had a nurse in that camp that she had been in nursing for 30 years, but something happened. And she just went down and started drinking. But once we got the drinking under control, we realized that, she could see the issues. Substance abuse, in her case, it was, something happened to substance abuse. We've had people that were substance users and they became homeless. So it depends on the situation and the person, but it can happen either way. It depends on life. And as we know, life happens. And it's how we handle it, or how sometimes financially stable we are or not financially stable.
I agree. We deal with a lot of people that are homeless, and sometimes, we'll get to talking with them, and they'll say, well, yeah, I'm an accountant, or I was an accountant. I got a divorce, and I started drinking, and I drink a lot, and I got into drugs and got into the wrong group of people, and I went through the money that I had in my bank account. I went through my son's college fund. I went through my family's money, and I've had family members help me. I've had family members sell their cars and their houses just to get me help, but I'm still out here. That's what we see all the time, and it's just not, your average uneducated person. It's accountants, it's lawyers, it's doctors. We see it, and unfortunately, we see it as former police officers as well that, get into a bad thing, that see something happen. We see bad things every day, things that people really shouldn't have to see, which that leads to drinking and possibly drug abuse. And, the officers lose their jobs and they fall into that same thing. They use their money for drugs and alcohol, ignore their families, ignore their friends, and they get into this hole and can't get out of it unless they have the right help.
My name is Ben Bacher, and I'm a Tiger Bay member. I'll pose my question to Captain Fowler, now that you've comfortably been able to sit down again. All municipalities and jurisdictions have some levels of the criminalization of homelessness to some extent. You referenced for the city organization that there's the camping ordinance that you guys have put into place. Do you feel that law enforcement, whether it be city or county, is the best organization to spearhead the issue of homelessness? And if you do feel that way, what programs do you know of that both the city and the county use to implement that? And if you don't think that they should be the ones spearheading it, who do you feel would be the best organization to kind of tackle that issue?
I don't necessarily think that it would be law enforcement's job to spearhead something like that. It would be a group effort. Mental health industry, the medical profession, everybody has to work together, the community. I mean, it's not one single entity's responsibility, it's all of ours. And unless we work together, all we'll see is this problem to continue. And it'll continue far into the future unless we get a good handle on it. And the only way to do that is to work together and form a committee, come up with good solutions, enact those solutions. Like Adele said, there's other communities across the nation that have really good programs that have put a dent in their homeless problem. The small houses, it sounds funny, but I watch a lot of home and garden television with my wife. I'm sure everybody in here does. one of the good shows is tiny houses. If I'm sure some of you have seen that, and I'm just amazed at what you can get in one of those small houses. Is that a solution for us? It could be. Where do we go? Where do we put them? Is it going to be in the county where Manatee County Sheriff's Office has to deal with it? Will it be in the city where the City of Bradenton Police Department has to deal with it, or whatever organization it is? But the only way we can do it is all get together and come up with solutions and work together.
Xtavia?
Xtavia Bailey, and I am a member. My question probably would be more for Adele and Avery. I just linked up with Valerie Gullery in Sarasota, and she's linked up with Harvey Van Groff to buy these hotels, to change these hotels into, these rooms look awesome after they have renovated them. And my question, I have a couple questions, would be, have we done what they're doing? Have we came together? And who's actually coming together to help this issue that we're having? My father was an engineer. He chose drugs, went into those woods, those same woods, and we lived in our car. And I was the student that came in, and I had someone reach out. But how do we know these students? How do we know? Like you said, some of them are being missed. So how do you find out if a kindergarten or a fifth grader or a high schooler are living in their cars, because they might be too ashamed to admit that they are actually living in their cars? And for me, I'm probably a big sucker, but I give money all the time to people holding up these signs. So do we do we buy food for them, or do we hand them the money? Because I don't assume everyone has a substance abuse problem. I assume that they're going to take the dollar or the couple dollars and buy a hamburger. But most of all, who in Manatee County right now? I heard she say that there has been the county commission did a research on that. So where did we go with that? And who's coming together at the table right now to help the problem that we have going on in Manatee County when it comes to homeless?
Okay, so lots of questions there. Who wants to start? And I will also say, as someone is choosing to stand up, that the county is working with Harvey Van Groff. I'm so proud to say that that is happening, because he is a problem solver and he is changing housing for people in need. So I think you're going to see more of that in Manatee County. Anybody want to tackle any of those questions?
Yes, I think Harvey's great answer to a certain segment of that population, but there's lots of other parts of that whole gap issue that he's talking about. We've got so many different populations, the elderly, we've got the single men, we've got people living on their disability checks, we've got all of those different groups that we need to address when we're looking at this housing. And that certainly is wonderful, because those people who are working and that 30% that are at risk, that's housing for them. That's wonderful. And let's hope that that goes forward very quickly, because we need it yesterday. But as far as how do we recognize how many people or how many other kids are out there, the school district has this program, Project Heart, which has people in all of the schools identifying kids that are homeless. So the school nurse, the school teachers in each of the classrooms, all of those have been trained to see what kinds of things. They see the same kid coming to class every day in the same clothes. That kind of is an indicator, different things that they've been trained to identify who might be homeless, and then they take them aside and talk to them and they find out their situation. And that's how the school district identifies 2,000, but of course that's probably not getting everybody, but there's really hard because of the stigma associated with being homeless. You don't want to be identified as homeless, so they're not going to self-identify. So that's the best thing that we have right now.
Real quick on the other piece about the homelessness, and she hit on it. That helps some. The fixed income is not included in that, because a lot of those places are going for like $600, but if you only get $730, you can't spend $600 on rent. We still need to look at the smaller homes was mentioned, and USA Steel, if anyone knows where their building is off of 44th on the east side, they have those smaller homes, and they have from one-room efficiencies to three-bedroom homes that are smaller, that are compact and affordable. And we need to look at that because we don't have to go far to see or to get anything. The information we have, the survey's been done. We did it in Manatee, they did it in Sarasota. And we keep paying people to come in to tell us what we know. I mean, if you go to the county website, look at the 10-year plan, everything he said is in our 10-year plan. Let's get together. Let's get that 10-year plan. Let's make it another 10 years and actually work on it.
Hi, Misty. I'm Davis Graham. I'm with Manatee Diagnostic Center and MRI, and I am a Tiger Bay member, and I just renewed my membership. So this is to Adele. We had that out of the box thinking, by the way. They just recently had a reception Tuesday night, and they had the viral Piano Man come and play, and my hat goes off to I forgot her name, Xtavia, and then also I have a friend that also lived in a car with her daughter, and has overcome that portion, and it was from a divorce. But you mentioned at the turning points that there's 2,000 children in this community that are homeless. Avery mentioned the Mississippi levee scenario where in the 1920s people would come to work on the Mississippi levee, pay the for housing and clothing, and could never get out. And then you and I talked about the modular home, and then also maybe staging it like from, a single like pipe-like that they use in Japan, or you can go to the airport and you see those places where you can sleep for an hour, and they're just a little box, which is kind of cool. But using that technology, but then funding it underneath like a tax relief. So for like vacant property, how long have we had subdivisions with infrastructure, with sewer, that are just sitting there empty? Why not give them a tax relief and then putting a tiny house like that infrastructure? Do you know what I'm talking about?
Yes, but
Okay.
I'm not sure I'm the one who can answer why
Well,
not.
no, this is my question to you.
Okay.
All right. So, because I wanted to get back to the question. I'm terrible at that. My mom's right behind me. You'll see. It's hereditary. Second behind. What population of the homeless want housing? That's my question.
What percentage you think?
Yes, and then from that percentage, make that the goal, and not, because you can't solve everything at all times, and to step it up.
Okay, I'm going to address it in a little bit different way. One of the major goals of the Obama administration was to end homelessness by 2015. When it was 2014 and it was clear that wasn't going to happen, they kind of moved the end goal, okay? So now the goal is by 2017, I think we're supposed to try and do that. But what they did do successfully, very successfully, was to end chronic homelessness among homeless veterans by December this year. And many communities, I would say not thousands, but a lot of communities were able to do this because they had a plan, they had a group that was working towards this, and most of them were funded by SSVF, or Supportive Services for Veterans Programs, or the VA has been pushing a lot of money as resource money to help these people get into housing. And there are communities that they call functional zero. They do not have anybody who's not been approached on their streets. There are still some who are out there because they just can't come in. And then they are zero homelessness. So
Okay.
the idea is that if you are able to promote some of these plans, these solutions, to be able to get these veterans off the street like that, then let's see if that can't translate to also the general homeless population. It's a little more difficult, but some of the solutions that they used were having their housing authorities identify 10% of their housing for homeless people.
Cool.
So in Manatee County, we don't have any. Sarasota County has, I think, between 5 and 10% of their units that they designate for homeless people. So that's an easy step that we can do to do that. They also have what they call that list of people most at risk in your community. So those of us who work at Centerstone, Salvation Army, Manatee Glens, the police force, we could probably name you the top 15 people who should not be living on the street. And many of you may have seen them. They're the ones who are walking around talking to themselves, dressed in an overcoat with a hat when it's 100 degrees out. They are at risk. They're not safe on the streets. And a lot of them have schizophrenia. Mm-hmm. So if you're able to, what they've found is these housing first proposals where you put them into housing and they have supportive services around them. That's a much more successful and cost-effective way to get those people off the street. And many of those people are the ones that are causing the desecration and the problems downtown because they're scary.
Yeah.
I mean, some of them have gone off on us when we're at the one-stop center, and we can't let them come anymore. So now they've cut themselves off from all services. So those are the people, I think, when we get this committee together, that's one of the major things we need to do is get this list of people and one by one put them into housing. And that will go a long way towards a lot of the problems that we see with chronic homelessness.
Thank you. Just by the way, 8%, Florida, 8% are considered homeless. California, 22%. That comes from 2013 HUD.
Thank you very much. And we're going to try and get to all of our questions. So if you could please have your question be concise.
Right.
Thank you.
I'd like to thank somebody from the county, Betsy, for being here. And I see so many faces that are always here. And how many of you would volunteer to be on this committee to solve this problem, which is real? Put your money where your mouth is. It is a dire problem. I've seen the motels. That is a wonderful idea, and it needs to go through. Take all these delinquent motels and get them into housing. The other problem we have in this county is salaries, minimum wage. They can't live on $8 an hour. What can we do about that? And that, I don't know who can even answer that question, but that's a must.
And that is a very tough question. I'm not sure if there is anyone here at the panel who can address that, but I will tell you, personal experience, my brother is homeless. He lives with me. He makes minimum wage. He manages a bakery at a grocery store. He cannot afford to live anywhere. So it is a real problem. Does anyone want to tackle that?
Actually, your brother's not considered homeless by HUD.
Okay.
But that is a problem, and he is homeless, but HUD don't consider him homeless. So that would be a problem that Manatee County would have to address. That goes back to getting the committee together and bringing everybody to the table. Business owners, store owners, shoe owners, mom and pop stores, everybody to address the issue of salary. Because if we don't put that in the pot, we're never going to get to solve the working homeless problem. And that is a big problem. And that's another thing. Let's get the committee together. Let's get everybody to the table and try to see what we can do to solve it.
This is Wileen Graham. I am a member of Tiger Bay. I have two questions. One, this was a few years back, but I was working as a public health nurse, and I had a patient that was being discharged. She had no place to go. So I took her to the Salvation Army to see if she couldn't stay there. They required me to take her to the police station to get approval that her record is clear. Is that something that is still in force?
We haven't really done that in a long time,
Oh,
but
okay.
on occasion.
That's how old I am.
I mean, within the past maybe 5-10 years.
Yes.
Back when I was a patrolman 20 years ago, when we had an instance like that, the Salvation Army would send them to us first. We would make sure that they didn't have warrants and they weren't, a criminal or wanted for something major. And we would actually keep the forms at the police department. We would fill the form out and give it to them, and then they would take it to Salvation Army, and they would get a place to stay. And of course, we would come across people in need while on patrol, and we would take them over to Salvation Army ourselves, and we could actually, run their names on the radio and see if they had warrants. Or back then, they would say, okay, a police officer's bringing you here, and they're saying that you need help, you need a place to stay, come in. But, times change, and now we don't get called very often to do that.
Yeah.
So they have a specific set of rules that they follow now, and sometimes it doesn't include us.
Right.
So.
Well, I know with this woman, I think she had tried to furnish a name and she couldn't. So I ended up checking her into to a motel for a night. But the other question I have is there any, whenever they come into like One Stop, is there any ever question of, their background as far as could they qualify for a scholarship like MIT where they can get into learning some of the basic skills or some, so
And
maybe
if you have
that's
a quick answer to that, please, so we can
yeah.
get all our questions.
I'm not sure they could get into MIT, but
Well, MIT,
definitely,
I'm sorry.
yeah, I know.
MTI is right.
Yes.
Well, they're
But we
like
do have people,
MIT.
everybody who comes in goes through an intake process, and at that time, they're screened for what their needs are. And if it looks like training or education is something that they could use to help them out, then that's one of the things that we can refer for.
Oh, great. If I could just make one comment on my own part. We took in a man to do yard work, and he was homeless. But we asked him, you're going to see our home. We want to see your home. He had a great home in the bushes. He had a big barrel that he kept his food in and a lid on it to keep the rats out. And he had a little platform he slept on, and he'd even gotten somebody's Victorian relative portrait hanging on the tree. So in his working, we said, well, let's say put some money aside so that you can rent a place. Well, we took a proportion of the money, and finally I found a house over in Palmetto. They had a room for rent. So I took him over there, and he went in and checked it out, and his remark was, there is no equity in my investing in a room.
Thank you. Commissioner Benak.
Betsy Benak, I'm a board member at Tiger Bay. I'm going to ask a question that I know the answer to, in case you guys don't. So,
You're good at that.
what is the, and I know Misty knows the answer, what's the maximum density in Manatee County, and what's the density proposed in a Harvey Vengroff hotel transition?
And who are you directing that question to, Betsy?
Anyone there who can answer it? If not, I will be glad to answer it. Since you don't let me make a speech.
So why don't you go ahead and tell us,
Okay.
Betsy, because that's a very good question.
Yeah, the maximum density in Manatee County is 9 dwelling units an acre unless you were previously established for higher than your grandfathered in at 16 dwelling units an acre is the way the comprehensive plan reads. You can get a bonus from 9 to 16 if you do affordable housing. But a development like Mr. Vengroff is proposing is approximately 30 units per acre. Because once you change those motel rooms into a residential unit, you're talking 30 units an acre. So the key word there is density. People want to know what one of the problems is for affordable housing? It's density.
It is.
Then I do have a question for Adele. What exactly is housing first? How do you make it happen? And does it work?
It works, and that's why most communities are looking at that as a solution now. Basically what it is, it's very simple, is instead of making people jump through the hoops, as we usually do, okay, you get sober, you're off your addiction, you get a job, and I'll help you into housing. In Housing First, it's the other way around. We'll help you into housing, and once you're in there, we'll help you with all those other supports to help you get off your addiction and get a job. And what they've found is that it's far more successful. They've got success rates 85, 90% with people, and it's very counterintuitive because you think I'm going to put a drunk in this apartment and they're going to keep it nice. But what they found is that people, especially who are addicted, many of them are self-medicating because it's the only way they can live on the streets. And if any of us were in their position, we might be doing that too. So when they actually are in a house and they feel safe, and they've got the supports they need, that actually that's when they're able to make progress and get off their addiction. So it's been far more successful. It can be used in almost any kind of situation, multiple family units, scattered site housing, but it's the concept of not making them do those things first, but putting them into housing first. But not just putting them into housing and then say goodbye, thank you. You've got to also have those support services to help them then get into whatever their problem was.
Okay, thank you. And this will be our last question.
Hello, I'm Kay White. I am a member of Tiger Bay. I would like to start by thanking Adele for giving us the definitions of homelessness. I thought that was really informative and gave us the scope. I don't know if there are any solutions that you have that have not come up, but one of the discussions today about this research and this famous committee that everyone wants, we have a number of civic and private sector leaders in the room today. Who is going to take charge and who is going to be responsible for getting this committee up and going?
That is a great question. Who's going to answer?
I don't know. This is what I've been asking for is, that's why I'm saying I think a good place to start is the Faith-Based Alliance, because they've already got a core group of those people who are necessary. So if we can build on some people from that group who are willing to start, and that's what they're heading for, that we can at least use that committee to start recruiting people. So if you get an email from the Faith-Based Alliance, be sure and answer it. One thing I just wanted to also say that all of you can help in this room is that the governor's budget that he recommended, he's looking at sweeping the Sadowski funds again. Last year he appropriated overall 131 million, and they swept 172 million, which left a lot, not very much actually, for housing. And this year he's looking at taking most of the money, 57% of the money for sweeping, which would leave only 47% of Sadowski funds for housing. So write to your legislators. This is one thing we can all do, is make sure that the Sadowski fund gets 100% used for housing, because that is money we can use in our community to build these low-income, subsidized kinds of housing situations.
Thank you very much. And so now we have board member Becky Knass, who's going to tell us who won the Tiger by the Tail Award.
Usually it's a real standout question that's obvious to all of us, but today it was a wonderful discussion. I commend all the people that came up and asked questions. We got some very thoughtful and very engaging questions, and it was difficult for me to sort them out, but I did. And in the end, I really thought that Davis Graham's question was the most thoughtful and engaging, and here's why. He described a personal experience with a friend who's homeless. He mentioned the viral Piano Man, which for those of you who haven't seen it on Facebook, it's a homeless pianist that was playing in Sarasota on their pianos that are in the community, and it was just beautiful, and it really puts a face, I think, on this issue. And then he asked about what % want housing. And I thought that really generated the best answers, because we learned about functional zero through your question. We learned that 10% of the housing is dedicated for homeless in other communities. And then Adele mentioned that they all know the top 15 people who need to get off the street for safety and mental health reasons. So we really dug deep with that question that provoked that conversation. So enjoy the cookies.
Thank you. And so Davis, at the end of the program, we will give you the button and the cookies. And please wear your button with pride every time you come here. So thank you all very much for being here. Thank you for a great year at Tiger Bay. Please renew your memberships. Please join us again. Our next program is going to be in February. We will skip January. Ben Bacher will be your president. I would be remiss if I did not thank Elaine, who holds this organization together. She is in the back. Thank you, Elaine, very much for all that you do. Thank you to Pier 22, and we'll see you all next year.